Hello, my name is Corey Morris, and I'm an osteopathic medical student. Our guest is Dr. Mary Hanley. Dr. Hanley was born and raised in the greater Hartford area of Connecticut. She graduated magna cum laude from Salve Regina University in Newport, Rhode Island. After serving in the United States Army, she attended and graduated with honors from the University of New England College of Osteopathic Medicine in Maine. She received several awards, including the Award for Clinical Excellence and Outstanding Medical Writing Award. Dr. Hanley did a transitional year at the Union Memorial Hospital in Baltimore, Maryland. She then completed a residency and fellowship in anesthesiology and critical care medicine at the Johns Hopkins Hospital in Baltimore, where she was chosen to be chief resident. She joined the faculty at the Johns Hopkins School of Medicine and taught medical students, interns, and residents and fellows in anesthesiology. In 2008, Dr. Hanley contracted necrotizing fasciitis in her right hand and arm. She lost most of the functional use of her right hand and underwent more than 10 surgeries to save her hand and arm. Her new disability made it difficult and unsafe for her to practice. In 2009, Dr. Hanley began a new chapter in life as a resident in family medicine at Kent Hospital in Warwick, Rhode Island. She was once again selected to be chief resident. Upon completion of her family medicine residency, she was offered a fellowship in Kent Hospital's new Undersea and Hyperbaric Medicine Fellowship Program. She completed her training in 2012 and has been practicing wound care and hyperbaric medicine since that time. She became the fellowship program director at Kent County from 2013 until 2018. In 2018, Dr. Hanley accepted the position of medical director of the wound care and hyperbaric medicine program at Roper St. Francis Health Care in Charleston, South Carolina. Dr. Hanley has numerous publications in peer-reviewed journals, has written multiple book chapters, and is editor-in-chief for StatPearl's board review program for undersea and hyperbaric medicine. She is president of the American Osteopathic College of Occupational and Preventive Medicine. She is on the faculty at Charleston Southern University, the Medical University of South Carolina, and Edward Via College of Osteopathic Medicine at Virginia Tech, and is a clinical associate professor at the University of New England College of Osteopathic Medicine. She is a national and international speaker in her field. Although her greatest accomplishment is being the mother of 2 Eagle Scouts and 1 2021 BS in Biology graduate of the University of Rhode Island. She lives in Mount Pleasant, South Carolina with her family and an Old English sheepdog. What is your specialty?
Practice wound care and undersea and hyperbaric medicine. I'm a medical director of a wound and hyperbaric medicine program in Charleston, South Carolina.
So why or how did you choose or end up in this specialty?
Well, I kind of like to think that it chose me. I was a very happy anesthesiologist. That was my first residency in anesthesia and critical care medicine at Johns Hopkins. And I practiced for about 8 years until I got necrotizing fasciitis in my right hand and arm and almost lost my arm. It was my dominant hand. So I was left with very little use of my right hand and arm. So it was impossible for me to do anesthesia safely. So I had to figure out what to do with the rest of my life in my early 40s. So I went back and did a residency in family medicine and got board certified in that. And towards the end of my residency, the chairman of the emergency department came to me and said, "Hey, would you be interested in this new hyperbaric medicine fellowship that we're starting?" And I said, "Well, I don't know, what is it?" So I went over to the wound center. This was up in Rhode Island at the time, and spent some time there and met the physicians and saw the whole process and what they do and things they treat. And I was intrigued. And I said, "Yeah, sure. What the heck? I'll do a fellowship." So spent 1 more year training and loved it, had a ball, just really fell in love with wound care, and especially with hyperbarics, because it's so much of the physics and gas laws that I used every day as an anesthesiologist. I still apply day to day in my practice. And it's just really, it's fun. I have fun at work every day, and it's great to help people, you know, heal wounds, and get them out of their lives so that they can go on and be productive and happy once again.
Say that you're talking with a student or a layperson, and they ask you what you do, and you say wound care and hyperbaric medicine. Not a topic that a lot of people know about, obviously. How do
No.
you describe what that is?
Well, it's really funny because everybody mistakes it for bariatric medicine, for weight loss medicine and surgery. And so I have to explain, no, you know, hyperbaric means increased pressure, and we use oxygen at increased pressure to treat several different diseases and problems. You know, a lot of people know about the bends, decompression illness, and divers, and hyperbarics has been used for that for many years. But you know, then I get to explain, well, we treat a lot of diabetics. We try to save limbs and prevent amputation. We treat patients who've had cancer, who've been had radiation therapy, and then have wounds or are going to have more surgery. My son, one time when he was much younger, was asked what I did, and his answer was something to do with air. So that was it was a pretty good description for, I think he was about 8 years old at the time. But yeah, that's kind of what I tell people.
So, what does your day-to-day work look like?
Well, I still have the internal clock of an anesthesiologist, so I'm an early bird. I'm in the office usually by 6:30 in the morning, and that's my precious quiet time before everybody else gets here and before chaos ensues. So that's my time to catch up on things, to go over any labs. I'm sort of famous for calling patients at 6:30 in the morning with their lab results, but I figure if I'm up, everybody else should be up. Then I'm in clinic every day, seeing patients. We have 3 hyperbaric chambers here at our wound center that we run 5 days a week. They're pretty busy. We treat anywhere from 5 to up to 12 patients a day. It depends on how many patients we have on the roster at that time. So I'm responsible for hyperbarics as well as what's going on in the wound clinic, and for supervising. I have a nurse practitioner who works with me who's excellent. And I'm fortunate I can do all these things and sort of keep all these plates spinning in the air because I have a great staff. They, you know, they make me look good. So that's a key thing that I would suggest to anybody who's trying to set up a clinic or a practice is get the best people possible to work with you, because they'll just make your life so much easier.
What makes your work interesting, and why would someone want to choose what you do?
Oh, yeah, people ask me that all the time. Well, I think what I love about it is that no 2 days are the same. And I never know what's going to come through these doors. Yes, I see a lot of venous ulcers and venous insufficiency and swollen legs, and a lot of diabetic foot ulcers, and, you know, sadly, the ravages of diabetes, which, you know, as we know, it's an epidemic in this country. And we're really now finally focusing on preventing amputations in this population. In fact, we just opened our multidisciplinary limb preservation clinic, which we're running once a week, where I see patients in my clinic with a vascular surgeon, a prosthetist who can make orthotics and prostheses for these patients. We're getting nutrition and physical therapy and infectious disease involved. So we're making a one-stop shopping experience for these patients to get the care that they need. But those are the mundane things. And every once in a while, you know, they tell you in medical school that when you hear hoofbeats, think of a horse, not a zebra. Well, every once in a while, a zebra comes in here. And I really love the zebras. I like when they come in and they say, I've been to Dr. X, Y, and Z. Nobody can tell me what this is. And you know, I'm at my wit's end, and I'm the one who I like to look under the rocks and try to figure out, okay, well, what tests haven't been done, or what can we find that maybe somebody else just didn't think about? So to me, that's what makes, you know, wound care fun. That's what makes medicine fun, is, you know, being that doctor of last resort that, you know, you can finally say to the patient, hey, this is what it is, and I can fix it. Or you can send them to the right person to fix it. So those are the things that I find really gratifying, and that I'm fortunate and blessed enough to see almost on a daily basis.
What advice would you give a student or a resident interested in your field of medicine?
You have to have a strong stomach. I've lost a few medical students along the way. But you have to be able to, and I think as osteopathic physicians, we're uniquely qualified for this, because I look at the whole patient, not the hole in the patient. So when I'm looking at a diabetic foot ulcer, I'm looking at the wound, but I'm looking at the person walk, and I'm seeing how their gait and their foot abnormality, the abnormal biomechanics in the foot, is throwing off their pelvis and their sacrum and their spine, all the way up to their C-spine. So, you know, if you really want to practice truly holistic medicine, where you're looking at the whole person and you're trying to fix the whole person, then this might be something you're interested in. If you enjoy doing procedures, I do a lot of debridements in clinic. I do a lot of application of skin substitutes, split thickness skin grafts. If you enjoy that kind of thing, if you like to see progress fairly quickly, I mean, some things take a long time, but you know, some things I can heal super fast and the patients are delighted. I think that, you know, this is a good field. And if you're, you know, if you're a science nerd and you enjoy the physics and the biochemistry and all of that's involved in hyperbaric medicine and wound care, then you should definitely consider it. And a lot of people get into hyperbaric medicine because they're divers, or they've been, you know, in the military and done some diving too. So that's a great background for it. I did get dive certified while I was doing my fellowship, just because I felt like I should know, I should be able to understand what a diver goes through, who's, you know, diving hopefully safely, and never going to need the chamber. But that was a great experience. It gave me a lot more insight into dive medicine too. So there's a lot you can do with it. It's a growing field. The population is aging. Like I said, diabetes is an epidemic, especially here where I practice in the South. So there's going to be exponential growth and need for more people to go into this field.
How did you get involved in the American Osteopathic College of Occupational and Preventative Medicine?
I think it was 2017 or 2018. The former president, Dr. Patricia Hunt, reached out to me and said, hey, we're looking for someone to give a lecture on hyperbaric medicine at our conference. It's going to be in Fort Worth, Texas. Would you be willing to come? And I said, sure. At the time, I was doing a lot of traveling and a lot of speaking. And I said, sure, I'd love to. I really didn't know anything about the college. And so I came down, and I ended up giving the Kenneth Ryland address at the mid-year conference in Fort Worth. And I was so impressed with the people who were there, how friendly everybody was and how receptive. And it was just a really fun group of people and really smart people. And I just really enjoyed myself tremendously. And I thought, this is a group I want to hang around with. So I started to, I joined and I went to the meetings, and then I got asked to be on the board. So I spent some time on the board and got to know Jeffrey, as you know, who's our executive director, who's wonderful. And then, the next thing I know, after being on the board for a bit and being the vice president, they said, well, you're going to be the next president. And I was like, well, okay. But I'm really thrilled that they found me and that accepted me into the fold. I think it's probably one of the most collegial, receptive specialty colleges, I've ever been a part of. I really get a lot of professional gratification out of working with this group of very dedicated, very smart people who've, allowed me to tag along and talk about all this crazy hyperbaric and wound care stuff.
How has the American Osteopathic College of Occupational and Preventative Medicine, or AOCOPM, helped you in your career?
Well, I think, one of the first things is networking. You meet a lot of different people at the conferences, not just fellow DOs, but MDs and researchers. And we have a huge brain trust among our members. Some of them are semi-retired now and they're not actively practicing, but just to be able to talk to some of these folks, you can learn so much. And I think that it definitely, it's made me a better physician. And in all honesty, I think it's made me a better person, because they're all such nice, honorable people that it makes me want to be a better person when I'm around them all.